It's Dr. Vartanian, and what's a dentist doing holding up a Botox needle? Who would have thought that Botox would be used in dentistry nowadays? For Victoria, we're going to apply some botulism toxin to her muscles in addition to the splints she wears so that we can hopefully give her some of the relief that she needs. Botox kind of came into the realm of dentistry by being more of an off-label use. What was found was that it helped the muscles. When you clench and you grind, your muscles tend to get bigger, get stronger. They get sore more often. Even though you wear your appliance or your night guard, some patients benefit from having an additional level of help. What the Botox does is it helps quiet the actual muscles down. Hopefully the combination of both treatment modalities will get you to where you need to be so that you get relief and you're comfortable. Botox therapy is complete on Victoria. Soon she should feel the relief and see the results that she's been hoping for in conjunction with her night guard therapy.